Okay, hello everybody. This is Penny, and I'm going to start my slideshow. This meeting was at the request of a couple of communities that just wanted a, excuse me, one last refresher on what needed to be done, what needs to be done to be compliant with the Minnesota Assisted Living Review. There's also some information that has recently come out from the Minnesota Department of Health that I think will be helpful in this discussion. So that is what this is. So we'll go ahead and get started here. And as always, we start our meetings with a prayer. So please center yourself, relax, take a deep breath. Thank you for the opportunity to care for the world you have made. Great vision and enthusiasm for our work. Influence of work in this location and beyond. Lord, as we plan and share together now, may you guide us by your Holy Spirit and lead us into all truth. Amen. Okay, so just a couple of housekeeping things that are related to the Minnesota Assisted Living, but not directly into compliance. And so one of them is there is also legislation that says that there is to be a scorecard created for Minnesota Assisted Livings. They so far are mimicking it very closely to the nursing home assisted livings is the reports that we've been given. And once the surveys have been completed, they will have all this new data in which to create a scorecard. But in the meantime, the only data that they have or can have is the surveys, the satisfaction surveys. I believe 100% of you have received a letter saying that they will be surveying your residents. So just wanted to kind of remind folks that this will be public information. It will be posted as a scorecard. So we want to have a good score. And so,
Penny?
Yeah.
And sorry to interrupt. Are you sharing your screen?
Oh, I thought it was, maybe not. Do you see it now?
Yes, thank you.
Yes, thank you for that. So we will be compared to others. We want to make sure that we've got good results. So I did ask Janice to look at trying to give us a letter or some talking points that we can use for our residents, but really I just want to make sure, and you guys can do this at a local level. I did speak to Elle, who is at Windermere Way, and her survey, I don't know if it started yet, Elle, but they've already communicated with residents, communicated with her. So it is going to be persons on services and not on services. So if you have an independent living, then it will include them as well. So prepare all your residents, prepare your families, prepare your staff, remind them of the positive things that you've done for them lately. Remind them of all the good in the world, so that and let them know what it is. This is a scorecard where we will be compared to others out in the community, and it's so that they understand that it's reflected not just as an internal, but statewide, so that they understand the ramifications of this. So enough said about that, but I think it's important to make sure that we don't just rely on the surveys to do the communication for us. The other thing, and I know Barb is on the call if she wants to weigh in, but I thought it's important to let you know, as these surveys continue and as complaint investigations may continue, Duluth actually had a virtual investigation, actually spelled investigation wrong. And so with no exit, so that it was a desk review. She had to continue to send in information, just like a surveyor would come in, but it was virtual. And so just as an FYI, you may get in surveys that are virtual. And then just as an FYI, learning from this too is if you are asked to provide for a complaint survey, if you are asked to provide an incident report, the fall form for falls is your incident investigation. And for other areas, did get it clear from Trent and Ben that there is incident reports within ROMP that you can release. There are other things you can't. So if they are asking for other information that is in ROMP, then obviously check with Ben or Trent. So for all of us, all of you, our survey window is open. Minnesota Department of Health stats say that 17 surveys have been completed. Complaint surveys have also been initiated. So who knows which ones are going to be these virtual. Statewide, different sizes, both license types, wide range of resident units. They are now every 2 years. So they're saying you're in your 2-year window. And so now I'm going to switch to some slides that MDH actually presented last week. And so it covers a lot of what I'm going to cover, just some reminders of things that you need to do. And then in this, I'm adding in a couple of pieces from information that I found, but also Linda sent out, and I'm going to bring it into my screen here, a really helpful email that goes in great detail to what the state has been finding. She received this from one of the associations, so it's got a lot of detail for you. We're going to cover most of this today, but not quite in such level detail. So if you did not get that email from Linda, let me know, and we can get that out to you. So review of the paperwork requirements. So you have, yes.
Hey, this is Jerry. I don't know if you're going to mention it later, but just so you all know, in Minnesota, we are doing a mock AL survey in every community this year. We're trying to schedule them with the skilled as much as possible. And so we will be doing a mock survey for you. Hard to know. Everybody's survey window is open, you know, but we are on track to get that completed and give you that look by the clinical services group.
Thank you, Jerry. Yeah, and I am covering that. And also the state did give us some of their survey information. So I've got that on eSource as well. So we'll talk more about the surveys towards the end. So thank you, Jerry, for that reminder. So you need to display your new original license in each building. So make sure that's up. The Bill of Rights needs to be provided to all current residents. So hopefully that was sent out and that box is checked. UDELSA needs to be given to all current residents. You need to develop a staffing plan and have the daily posted on each unit. So again, reminder that there are two different things. So staffing plan is your plan of how you would staff with budgeted census and normal staffing, et cetera. It's what's in SmartLinks as kind of your set schedule. The daily staffing is what you staff for today. So for example, I was working with one of our communities and she said, oh, you need to up the UDELSA because I looked at my staffing and I changed it because my acuity changed. And so I said, well, no, that's your daily posting. You change your schedule, you change what you do. That's what you would post, but your staffing plan and how you staff is the same. And she said, yes, it is. I haven't changed that. So they're two different things. And the staffing plan, I did just send out an update for you. So how you come up with this is what I should, and then you need to check your staffing plan to make sure it's accurate, to make sure that you can meet your community's needs. So how you do, how you relate your staffing plan to what am I going to staff today, to posting of the shift and who actually showed up today is where you look at your points. That shows you the amount of care that you're providing and you determine, do I have too much staff? Do I have not enough staff? And so I just sent an updated version of that to you all via email. So let me know if there's any questions on that.
Penny, just for clarification, the daily posting has to be on each shift, not on each unit.
Correct. Yes, thank you. Okay, and then new policy requirements, any new policy requirements written and in place. And so on this, again, just remember when I've posted on eSource, and if we have time, I can remind you where some of these things are, but I've posted on eSource the policies that you have to offer to people. So you print that up, you put it in a binder and you say, these are our policies. If you would like a copy, I can certainly get you one. Now I'm still working on getting those up on a website, working on making them a little more pretty, but in the meantime, you have them, you need to offer it to them. And those are the policies. Oops. Okay. Newly developed assisted living contract completed and signed by each resident. So Ben wrote you a new contract. We personalized that. You have that in your new admission package, but you need to make sure that all of your existing residents have signed the new contract and that you've got that complete. Design and ensure your assessment tool is complete and meets the statute, ready to use. So again, we had a whole session on this on Friday. It is updated. It is designed to meet it. I'm going to talk about dementia care in a quick second here, but part of that is you need to have a person-centered plan. So that is that person-centered wellness that we talked about on Friday. So you want to make sure that you have that for everybody, ideally on Matrix, and that you can prove that you had that and you use that to make the service plan. Part of the assessments that you need to do is look at the behavioral aspect. If you have a dementia unit, for those in the dementia unit, you want to make sure that in your assessment you're addressing, are there any behaviors, and including behaviors in your assessment. And so when the survey asks you how are you doing that, you just need to let them know it is our policy to do that. The policy is on eSource. It's one of those you're handing to residents. You can show it to the survey. In the evaluation, it does talk about behaviors. You just want to make sure that you're pointing out that, yes, I know I have to do that, and I'm doing the behaviors as well. Jerry, would you add anything to that?
Sorry, I was on mute. You know, if you are having an individual that has a lot of behaviors, your service plan should identify those target behaviors, and then you should be monitoring that routinely through the tasks that the RAs do to how frequently that's happening, and then making plans that update to that current performance. Yeah, what's happening now.
Thank you. And then have an emergency preparedness plan in place. And so this is where I think a lot of us are going to get dinged, because as I go around to the communities and look at how we're doing on this, they say, well, here's my giant binder of emergency planning. So I've got one, I can definitely prove that. However, it hasn't been updated in a while, or I probably need to tweak it a little bit for the AL. So you need to pull that thing out and you need to look at it. And is it updated? Does it address more than just weather disasters or fire? Does it address pandemics? So you need to make sure that that plan is updated. You need to make sure that it purposely includes the assisted living. And again, on eSource, we have all sorts of tools for emergency planning, and then specific tools to help support the assisted living in the emergency planning. So a lot of this, again, when Ben and I interviewed you all, everybody felt like they were pretty up to snuff on this. But again, we're seeing a lot of citations according to MDH on the physical environment. So smoke alarm in each sleeping room interconnected, so that if one goes off, they both go off, the one in the bedroom and the one in the living room and the one in the hall and or in the hall. So they need to be connected so that people know that there's a fire. So you need to just double check that one. If you has to be in every bedroom, has to be connected. Smoke alarms, oops.
Penny, this is Steve. Just so you're aware, it's not the hallway outside of the apartment. It's within the apartment.
Right. Thank you,
Yes.
Steve. Yes. In the bedroom and outside of the bedroom. Thank you, Steve. So then if you're not fully sprinklered, smoke alarms on each story within the dwelling unit, including basement. So I know a couple of you, Red Wing is not sprinkled, and so you need to make that. And then some of you needed to add these because extinguishers need to be every 75 feet. You need to have, again, I'm pulling this from Linda's email, you need to have a log that indicates that they were checked and that they are a minimum of a 2 to 10 BC rating. So I don't know, Steve, if you can explain what that is, but it has to have a minimum rating. So you want to check the rating as well to make sure it's up to snuff and meets the regs. And then you want to make sure that you've got a log that shows that you check them every month. So these are some of the things that people are getting cited on. Facility connected to public utilities, properties accessible to the fire department, emergency medical services. Property is not subject to flooding. So again, some additional details from the association is that you need to have proof of this. So you apparently need to go to your city and have them validate or have something that shows that you're not in a flood zone, because they will be asking proof that you are not subject.
Penny, we can check with legal, because that may be something it would have to be listed on our insurance if it's in a flood related area. And then the property is accessible to the fire department and emergency medical services. And in many cases that requires that little lock box out the front door where it's included right on the outside. So they have access to the building 24/7. And if you're magnetically locked and you have to put a key card and a hard key in there, but they're just making sure that there's always accessibility into the building.
Thank you, Steve. And access to the building and all the emergency exits or entrances, in case the fire department has to go a different route.
And that includes, so if you remember on the skilled nursing facility side, you're required to maintain those sidewalks and perimeter things that go around the building. That was never the case before in housing, even though many of you did. Now you need to make sure that those paths are always cleared all the way to the egress. Just like you do on the skilled.
Thank you. Your plan needs to include how your residents got out. I mean, how you're going to assist your residents out. Twice per year per shift, you need to run a fire drill per shift, and one drill every other month, one actual drill every other month. And then you have to have proof that you trained your staff on the emergency plan. So it's not enough to have the binder and just have them do Educare, because Educare just talks about emergencies, et cetera, in general. It's not your specific plan. So you want to make sure the orientation includes your specific plan and that you can prove that. Any questions on that? All right, so on to MDH information. Identify your clinical nursing supervisor, your RN. Ensure that your named licensed assisted living director that BELTS is notified. Ensure that you have a wake staff on 24/7. So this one's pretty easy. These two, again, we've talked about this on Friday, is you need to make sure that the state knows who is in charge of your building. If you had a change in director of nursing, if you had a change in who is responsible as a manager, you need to let the state know. If that manager is also your listed licensed assisted living director, you need to let the state know, the licensing agent know. So me as an LALD, if I was going to go in and run a building, I need to let BELTS know that I am now in charge of this building, in addition to letting the states know that there's a new manager on site. Questions on that? Okay. So 3 nutritious meals per snacks day, 7 days per week. Have menu posted at least 1 week in advance, available to residents. Residents should be involved in the menu planning. Serve food according to recommended dietary guidelines, including seasonal fruit and vegetables. So frozen fruit doesn't count, needs to be fresh, and has to have that menu up 7 days a week. And the residents need to have opportunity to have input into the menus. And I think most of you have food committees or other ways that residents can give opinions.
One thing that was stated on the state call with this slide is that you can certainly have on your menu chef's choice, but you can have chef's choice 2 or 3 times a week. The menus need to be prepared and planned out and available 1 week in advance and then followed.
Thank you, Jerry. Okay, provide a means for residents to request assistance for health and safety needs 24 hours a day, 7 days per week. This did come up with leading age in the original discussions. If you have a completely, an independent living that you maybe do safety checks, but they don't necessarily have call systems or whatever, it can be the ability to call a cell phone that's carried. It can be other things. It could be a neck pendant. It doesn't necessarily mean that you need to put a pull cord in your independent living. There's other ways that you can look at this. And I think, again, when we checked, everybody was compliant to that. You need to have an infection control program in place. And per Jerry, our expert, our infection control programs already are in compliance, but they will ask you about TB. Again, in Linda's email, there's a lot of detailed requests on making sure that you have TB under control, that you're checking all new employees, that you have a program around it, that you're checking your counties. Is it your county's rate, Jerry? I forget what the policy says. I think it's county's rate, right? Of TB?
To TB?
The risk assessment you do?
Yeah, I'm not sure because you say I'm an expert, but I'm just holding it together.
They ask, this is Haran, it asks for the state rate and the county rate.
County rate, yeah, I thought it was the state rate. And
Both
if
of them.
Yep, and if you go in the policy library and you go into the infection control policies, there's a whole section on tuberculosis. So you should look at that.
Yep. And so there is a community risk assessment in that policy that she's talking about. And I know when we opened up Northfield, we did get, they asked us for that and we missed that piece. We got it right away. So that's something just to make sure you have, and that's the rate that Hodam was just talking about. Offer the opportunity for each
Jenny?
resident. Oh, yes.
This is Evans. I just wanted to mention that in COVID era we are now, EON should have a good process of explaining the process of identifying and controlling COVID residents and staff, how they manage that. So that is going to tie hand in hand as we do TB.
Thank you, Evans. Yep. And then offer the opportunity for each resident to identify a designated representative in writing. That is in your revised admission tools or admission documents for residency. And so just make sure that we're not missing that piece. And again, that we've gone back to the existing residents and given them that opportunity, which we've covered in the past, so you should all be good. Okay, have proof that your entity has an applicant who has experience in managing residents with dementia or previous long-term care experience. So this means new applicants have to show that. You being a provider that provided dementia care before the licensing and now after the licensing, and that you have been given the license, shows that you've proven this piece. So you should be just fine on that. But again, the vulnerability assessment, this is specific to memory care. This is walking around your building, walking around your grounds, looking at your outside area. Is there anything that is of a risk specific to persons and their dementia diagnosis? So if the gate does not have a latch on it and it's wide open, that's a risk. If you have a large body of water right outside your building, that's a risk. So anything that, and what are you going to do to protect people from that? So you just need to look at that sort of thing in your memory care. And there are tools for this on eSource. And you need to say, what are you going to do to mitigate that? You know, I'm going to put a latch on my gate. I'm going to assure that there's a fence around the body of water or whatever. That sort of thing is what you're looking at here. Ensure that you have awake staff 24/7 that are physically present in a secured unit. So this has always been a Benedictine standard. I don't think any of you don't do this. It doesn't mean that you have to have 2 people on memory care. You can certainly give them a break by have somebody float in from the AL and or through HR. There are policies that allow you to have a person who has to stay on their unit even during breaks. And so you should already be all set for that. And then assure all additional dementia care related policies are written and implemented. And we talked a little bit about that before with the behavioral assessment, as well as the other policies that are being given out on admission. So remember to offer the policies in admission, remember the behavior. The other piece that should have been here is reminder that somebody in your building, we recommend it be the director of nursing. But if you've got an education director that covers both the SNF and the assisted living, it can be that person. But somebody needs to have the Alzheimer's approved training. And so that was the one where the $59 was the additional certification. I know all of you identified somebody who was going to go to it, but I also know that life gets super busy and some of you have not been able to complete that. So cannot forget that piece. That is critically important, that your director of nursing or delegate, whoever is overseeing the education and training in dementia care, needs to have that specific training. Any questions on that? Okay. So job descriptions include facilities organizational chart, the roles of staff within the facility, and the UDELSA. So your specific org chart, and you have to review it with your staff. You have to give the staff the job description. You have to give them the org chart so that they understand here's who you go to for what. And then again, making sure that your staff have the UDELSA document. So all of that should be included in their employment record. And this is what we just talked about with the testing requirements. Verify the staff who conducted dementia training comply. And then have a plan, a schedule to get staff working in dementia licensed facility trained, and then validate orientation that includes job description and review. So again, should be in employment. Any questions on those pieces?
Penny,
Mhm.
the requirement for the job description and facility organization is not limited to dementia. That is a requirement, I believe, for all staff.
Yes, thank you, Jerry. Yes, that is true. Okay, and we're going to cover some other stuff in a little bit, but those were the MDH slides. And so going more through the MDH slides, survey findings thus far. Again, physical environment, missing or tampering smoke alarms, incomplete evacuation plans, vulnerability assessment, minimum assisted living facility requirements, individualized treatment or therapy management plan, document of administration of medication. So again, we have all of the resources for that. We just had a call earlier this morning to talk about some of the frustrations with Matrix. So this is really, you know, it's that compliance to Care Assist. It's not only proving that you have it, that you did it. So you did the evaluation, you did the person-centered well plan, and your staff is documenting that the care was given or the drugs were given or what have you. So if you have, again, the last report that Linda sent out looked great. Huge improvement, lots of green, awesome. They will be looking for that documentation. So, and then the other thing that Linda sent out just to go over again too is one of the things that people were reverting back to is they were going to paper because they had a lot of pool and they were having trouble logging in for the pool folks. And so Linda does have a tool that helps to make sure that you can get people logged in and a quick cheat sheet for pool staff. Linda, do you want to say anything more about that for the?
I think on the orientation to your agency, I think their e-source should be utilized. I know Evans has worked with Kathleen Murray on that. And then I would just make a little orientation book with the orientation to Care Assist book for reference so that they have them accessible while working, because it's nice to see the picture and where to go next. And so I've heard that they've been very helpful in some communities when they've done that.
Good.
Yeah, we do have orientation for all agencies who come to our communities. So please make sure you use that. If you don't have access to it, let me know. I'll direct you where it is.
Evans, one of the things, and this may not be the right time, but how do you orientate a person if there is no nurse there? If it's a weekend and they send somebody who wasn't originally supposed to come, what do we do in those situations?
The new agency nurse coming in over the weekend. Is that what you're asking?
Yeah, I think she's saying, because normally the community say, hey, I want my pool person to come in on Friday so I can train them and prep for their shift on Saturday. But what happens if on Saturday they say that person called off, so I'm sending somebody new?
So I will say the community has to make arrangement for somebody to come and orient that person. Yep. The fact that that person is not able to come on Friday does not mean that we will bypass that process. We have to make sure that they're well trained and they know what to do when and where.
So the expectation then is a regular staff person would be coming in to do that orientation on the weekend?
Yes.
Yep. You'd have to have an RN come in to do that. Because if they haven't produced competency from the healthcare agency, remember, we can transfer some of the training in that, but you still have to have that competency checked by an RN.
Thank you. Okay, other checklists, other things to think about here. And before I go on, any questions about what MDH said? All right. Okay, so legal check. notify the state that we talked about before. You do have to send your contract into the state. All of you have had your contract, actually the ombudsman, not the state, but I have sent it on behalf of all of you. But after I sent them, they sent me a note saying, well, now everything has to have a cover sheet. So resubmit them all with a cover sheet. So I am doing that for you. There's no timeline on that, so it isn't done yet, but I am working on that. A couple of you are done, the rest will get done. We talked about the change in the contact information, adding a manager. Hugely important, not only legal requirement, but to make sure that you get notifications. And right now I am listed as your authorized agent. So at some point down the road, I will take my name off and put yours on, but I'll let you know when and where I'm doing that and find out who you want that authorized agent to be. Okay. Any questions on that? All right, staffing check. There is additional Educare assigned that needs to be completed. And so Kathleen Murray worked with whoever does your Educare assignments to make that happen and to make sure that everybody had those attached to them. But you just need to make sure that your staff actually did it. And so check your Educare compliance. This one, I sent out a email about it quite a while ago. But again, just a reminder, your background checks are attached to your comprehensive home care license and your housing with services license. And so housing with services already sunset, and home care for many of you did or will sunset. And so the state sent out a notice saying that they are only keeping the background checks open for a certain period of time. So you must make sure you grab those employees and move them to your assisted living licensure on NetStudy. An email was sent. If it's not sounding familiar, let me know. Marie Blankenborough, if I'm saying that correct, is an expert at this and can help, but that is critical. Otherwise, you won't have the background compliance for your staff. And again, don't forget, under the new LALD, we have CEU requirements, just like a nursing home administrator. Make sure you're getting your CEU, make sure you're keeping proof that you have it so you can submit it to vets. All right, postings check.
And Penny,
Yes,
just a
ma'am.
clarification on that. I'm assuming any NAB approved training session would meet the requirements for continuing education.
That's a good question, and I'm assuming for the most part the answer would be yes, unless it was something like MDS training that clearly would not cross over. But otherwise, I would assume that that would be correct.
Okay.
I did talk to Kathleen, and so she is looking at how we make sure that all of the Benedictine trainings cover both, because NAB, National Administrators Board, I believe is what that stands for. And so this is more of a state level thing. And so she's just getting some verification on that. So in the next Benedictine gathering, she should have some more information for us on that. Okay. Any other questions on that? All right. So postings check. AL license at the board, emergency disaster plan prominently posted, and so it could be maybe a poster that says it's in this credenza right here. I don't know. I'm not quite sure how you put your emergency plan, on the wall, but it has to be there and available, and so people know where it is. Emergency exit diagrams for each floor, so it needs to be on the halls in the floors so people know how to get out. But some of you, as I'm updating your handbook, we need to make sure that those exits are in your handbook. So take a look at your handbook and and if it doesn't include those emergency exits, send those to me so I can include that in your handbook. 911 common areas and by phones provided by the facility so people know where to call for emergencies. The Minnesota Adult Abuse Reporting Center information and reporting number. Jana did send out what she felt would comply with both the SNF and the assisted living. you guys already have this on, or should have it on your SNF side. Just need to make sure you also have it on your housing side if there's a separate entrance there. Staff schedule for the shift on the main floor. So again, not by unit, but by shift. So just pull it out of SmartLinks. If you don't know how to do that, I believe Doty's already helped someone, but maybe somebody new. Doty can assist you in how you generate that report. And your grievance procedure needs to be in a conspicuous location. So again, grievance procedure is in the handbook. Part of the checklist for the admission says I reviewed the grievance procedure. So it's not only that the Benedictine procedures that we will have, we have a form, please fill out the form, but when you review it, here's where the box is that you put it in. Here's, somebody will get back to, this is how it works. You write it down, or you can tell us, or you can whatever. We have a customer concern database where we log it and we'll get back to you, and we track it and trend it. So just telling them what it is and personalizing it to your community. Electronic monitoring. This was a reminder from Leading Age that in addition to what is in the regulations, it's a separate regulation, but they will be looking for your electronic monitoring sign. So the facility must post a sign at each entrance accessible to visitors that states electronic devices, monitoring devices, including security cameras, audio devices may be present to record persons and activities. So at the time that this came out, marketing sent something to everybody that had this in a nice, pretty format that you could attach to your door, not so large. So look at your door. If it's missing, contact WorkZone and see if they can send you another one of these in the Benedictine format. Another thing is required readings. This is another thing that every time I talk to housing leaders, not saying everything on this call, but it's the one thing, yes, I meant to get to that reading. I'm trying to get to that reading. I've got the book right here. They're going to test you on it. Now we've talked a lot enough that you probably, hopefully can pass the test anyway. But the required reading is on eSource, needs to be done. Got to read this stuff, guys. And then Jerry talked about this before, that the clinical team is going to be doing mock surveys for assisted living. If you want to get a jump start on what the state will be looking for, this was published by Minnesota Department of Health, and just talks about the things that they will be asking for when they come in. So look into each one of these and make sure that you've got your survey binder kind of put together and have this ready. I know Matrix will now do the resident roster for you, which is super cool. Anything that you want to check yourself is right here. And I believe, Evans, you make public the mock surveys too, right? So if they want to get ahead and look at what you'll be looking at, they can get that from their RNS. Is that correct?
Yes, again, I wanted to say, as Jerry said, the mock survey template for assisted livings is a guide for all the process and everything you've been mentioning. So they can use that too as they get ready for our surveys and annual or biannual surveys.
Perfect. Thank you.
And you can do that yourself. You can just take the form that we've created, go and look in your employee records and see if someone can produce the information that the surveyor is going to need. So, many times what we find with generally is people like, yeah, well, I told them, and we talked about that, and it's supposed to be done. And what we do with the mock is to verify it's been done, but that's certainly something you can do at any time. Should you have want to verify, go and look and see. Thanks, Penny.
Yep. And I'm somehow my checklist got closed here, so I may have to reopen this. Give me 1 second here, guys, and we'll just walk through the checklist one last time. Let me see. Oh, no, here it is. Here we go. Okay. Can you all see the checklist?
Yes.
Okay, so I'll send this out again too. So again, read your regs, identify your LALD. This is already done. Provide notices, only Heritage Meadows did that apply. Determine who's your supervisor, make sure the state knows. Prepare for application, done. Revise contract and reissue. So again, make sure everybody has it. Offer them the designated representative. You've already done your UDELSA. Make sure everybody has the Bill of Rights. It's in your admission package. Make sure that you're offering everybody the policies. Revise the assessment tool. That's been done. Complete required assessments for residents. So again, just reminder, Linda sent out to a couple of you a reminder this morning. Because we had to rewrite, because Linda had to rewrite Matrix in order to comply with the regs, and the clinical team who helped her to come up with the new documents. Thank you, clinical team. It required such a change that the old evaluation doesn't carry forward into the new evaluation because it's an apples and oranges kind of thing. So when you do your new assessment and you're starting over, which you guys have already been doing since August 1st, unless the person's care has changed, the points should not have changed. So if you're seeing the points change, something's wrong. So go back and look, what did I do the last time versus what I did this time? And did the person change, or did just how I documented it change? So Linda, anything you would add there?
It's not everything didn't carry over, just the majority of things didn't carry over, but you still have limited. It really wasn't really too bad. It was just, and I gave you some examples. I think you just maybe missed the weekly vital signs, or maybe that got discontinued since the last assessment. It wasn't saying that they were wrong. It's just, I would investigate to make sure you didn't have a change in points. So just wanted everybody to make sure we were aware of the new evaluation template.
Okay. And again, we talked about this at great length on Friday. Person-centered plan. The person-centered wellness document is your critical piece. If you're doing it on paper, please move to Matrix, but make sure that everybody has that. They will be looking for that for folks. Staffing, we talked about the 3 separate things. There's SmartLink, there's a daily posting, and when the RN has to evaluate the staffing, there is the staffing assessment tool. And I did send a revised one out this morning that indicates the new Matrix report that will tell you who changed. So it'll make it a little easier. And it also gives you the totals on the bottom. So you don't have to add up. You don't have to export the Excel and add them all up. You could even do it on a calculator because Matrix will tell you. So again, send those instructions out. If you have any questions, please let me know.
Oh, can we add one more thing? Just, and I'm gonna like butt right in here, Penny, but the Minnesota client roster form that we have to do for MDH is now updated and live in Matrix Care Senior Living. It is not attached yet to the evaluation, but go ahead and make sure you guys are just doing a copy over roster, and it will bring into the new roster, and everything will copy from the previous one. So you don't have to manually track your roster forms for MDH. It can all be done very easily through Senior Living now.
Okay. Meal offerings and add meals and snacks if indicated. So if somebody says, how are you making sure that people have food available to them 24/7 and that you've got snacks available to them, you got to have an answer to that. It doesn't mean you need to staff your kitchen 24/7, but there should be some, individualized snacks available where staff can give it to them. Can also mean that they're welcome to have food in their room if the rooms have kitchens. And then I would do some very purposeful for those on services, making sure that they have offered an afternoon, mid-morning, mid-afternoon food available to them should they so choose. So what is your plan? Making sure you can easily answer that question. And then assure that meals are compliant to dietary allowances. As long as you are using Meal Suite, Denise assures me that you are compliant, so you should be fine. Host your meal, and if you have any questions, obviously ask Denise. Post menu in advance, determine the communication to the staff person who is arranging transportation for assistance with assessing community resources, social services available in the community. So we did change in the assisted living documents. You'll see that I'm just referencing the housing manager there so that we don't have to personalize it for that person. So if it's not the housing manager and that document is incorrect, then let me know and I'll change your admission documents. Develop daily program for social and recreational activities. Consider available outdoor areas for activities. So make sure that you've got outdoor included in your activities. Make sure that it is befitting of people who are a little bit more cognizant, and able to move about, to do more things than bingo. Make sure you've got that robust calendar that fits assisted living and or the special programming for memory care. So you can show that. We talked about the infection control. Councils, again, a lot of you are saying, the housing leader holds the resident council, or the housing leader holds the family council. The housing leader doesn't do any. Under the new regs, the resident council needs to be run by the residents. The family council needs to be run by the family. And then you basically give them a secretary. We only come, the Benedictines only come if we are requested. So we want to make sure that we are not owning that. A letter is available on eSource. Again, I can point that to you if you need it for sending it out. You want to put on your calendar. You want to be able to prove to the state that you sent out the letter, unless you already have a resident and family council. You want to make sure that your council is resident driven, is family driven. And then if you don't have a resident council or a family council, send that letter out, mark a date, goes out every year at this time to let people know that they are welcome to join it and that we will help facilitate it. We talked about the postings. Talked about the emergency disaster plan and the fire drills, your missing resident plan, which was updated. But again, in your building, make sure who, you've got the policy that I believe Jerry wrote for us. But then who in your building is responsible for knowing what to do if there's a missing resident? The RA at 2 a.m. is not necessarily going to have that policy available to them. So how did we train them? How did we prove that we've trained them, that they understand what they're supposed to do in the event of a missing resident? Again, here's that person-centered.
Penny, the missing person, it's always the nurse on call is the person who accountable to manage that. So just training people that they need to call the on-call nurse.
Thank you, Jerry. Okay, and then update marketing materials, which we are working on, and then celebrate. So hopefully, as I went through this, you guys are all like, oh, I so have this covered. We're done. I'm ready for my survey. Any questions? Okay, there's one question from Elle. I'm going to go on eSource and just kind of show you what I'm doing here. An in-process deal, which makes it a little bit confusing. So I'm going to go to the admissions, go to Minnesota, and you're going to see a couple of things. You're going to see down here, Minnesota Assisted Living Admission Documents. You can see that it's got your new official names on here. And in here, for the things that had to change to keep you compliant, if you click on yourself, all of your residency documents are in here that assure that you are compliant. This is Marywood. They don't have people not on services. That's why they only have one. But if you look in here, you'll see people on services, people not on services. Let me find a different one. Field. So the residency date. So this is where you go to find, I'm going to be legally compliant. The surveyors are coming in. It is under the Minnesota Assisted Living Admission Documents 2021. So also in here is the forms and tools that include the different checklists, but it's also your policy handbook. So this is what you print up and put in a binder and tell everybody, would you like a copy of our policies? And then on the checklist, they're signing that they had the opportunity to have the policies. So that's where you find that. What is changing is that as I update your entire new admission file. I'm moving you out of the transition file and just into the Minnesota file. And so if I look at Ada, they now, because they still need their comprehensive home care, they have a comprehensive home care file. They have a nurse only for services after admission. They have residency documents. That includes on services, not on services, and respite. And then they have the tour document that is basically the same as it was before. So as I update and tweak and make sure that everybody's documents, because as you know, this file was a little confusing in the past, so I've kind of taken this on as my project. And I'm going down to the transition and I'm tweaking things, and then I'm moving it out here. So if it is your new name, this is a completed form that has everything that you would need. If it has your old name, it means that your tour documents, maybe your respite document is in here, but all of your residency documents is still in the transition. So this folder is a little bit in transition. If what I just said is confusing to you, let me know. And let me show you something else. Someone else wants to know, where is the recorded reading? So any questions on the admission documents? Okay. So now I want to find.
Any?
Penny, in that first section for resources, not under 2021, but on the original page, people were asking me if we could move the pre-admission assessment and the wellness form questionnaire to there. The two forms that maybe nursing might want to get off at any given time.
So move it out to the admission folder.
Move it to that resource. Or, yeah, they were wondering if it could be put in the resource
Yes.
area also. Okay.
Yes, I can move those out. Okay, so I do have a question. Someone wants to know where the read documents are. And I'm trying, housing, here we go, housing. Sorry, it's been a while since I've been in here. There should be a Minnesota transition. That's why we love eSource. I want to put it in here and I'm trying to remember where we put it. Does anybody remember where our, here, state assisted living? No. Our assisted living transition folder is?
Look under Minnesota right there, one more down.
Oh yeah, Minnesota, that's right. Thank
Yep.
you. Thank you, Linda. Okay, required readings. So here's the link. Support center housing. So you would go up to the top. So just to start over. Go to this little guy, document management, support center, housing, Minnesota, which is what I was missing. Thank you. And then assisted living transition 2021. And it's got a lot of the documents we talked about today, required postings, and here's required readings. And then the documents are all right here, so you can just click them open and read away. Okay. Any last questions? All right. Well, as always, if you have any questions offline, you know where to find me, as well as the clinical team, Linda, others are all available to help you. Otherwise, have a wonderful day, and thank you very much for your time.